Before make a definition of plantar fasciitis, we need to say what is plantar fascia. The plantar fascia is a band connecting in its proximal insertion the calcaneus, and in the distal insertion the tendons of the forefoot and the proximal phalanx. Then plantar fasciitis is an inflammatory reaction of this plantar fascia. The symptoms of plantar fasciitis are pain, pain when palpation of medial plantar calcaneal region, pain with dorsiflexion of the foot, and thickness of Achilles tendon and gastrocnemius muscles. Degeneration of plantar fascia is the result of repetitive micro tears that leads to an inflammatory reaction of this plantar fascia. The diagnosis of plantar fasciitis is essentially a clinical diagnosis. X-ray can help you to determine the chronicity of the disease, showing some spurs sometimes. Ultrasounds show the plantar thickness and the fascia tears, and MRI show also this thickness and the plantar tears and tendinopathies. 70 or 80% of the cases will have a good result with a medical treatment. This treatment associates rest, activity modification, ice, non-steroid anti-inflammatory drugs, stretching, and here in Aspetar we used to work a lot with the physiotherapies in this part, insoles and night splints, which are generally provided by our service of podiatrists, and extracorporeal shockwave therapy. And we also be able to do some plantar injections with corticoids, platelet-rich plasma, or autologous blood injections. Then the second part of the treatment could be surgical treatment, which could be done by open surgery, endoscopic surgery, or percutaneous surgery. The treatment consists on doing a partial or complete plantar fascia release, and then the patient used to benefit of 3 weeks immobilization and 3 weeks partial weight bearing after. The medical treatment is efficient into 1 to 3 months for the great majority of the patients, as I told just before, 70 to 80% of the patients. But after surgery, recovery can be expected in between 6 to 12 weeks, but some patients have not a complete resolution of the pains. This is why surgery is indicated only for patients with residual pain after 6 to 12 months well-done medical treatment. The best way to avoid plantar fasciitis coming back after the treatment is to adopt correct shoes, to wear correct shoes when we are doing some sports activity, and to avoid microtraumatism and macro tears.